Okay, hello everyone. This is Silvia Sattin from Italy. I'm sales assistant and marketing responsible of Adaptica. I hope you can see and hear us well. Thanks for joining us. I saw on the live chat that there are people from all over the world. So let me introduce Dr. Harbisian. He's an optometrist, and we first met him virtually on Facebook because we found a nice picture you will see later of him wearing our vision fit on his head during a project in Jordan with one side. He's an optometrist based in Vancouver, so here it's like 9 a.m. in the morning. Yeah. He has two optometrist practices in Vancouver. And he's an ambassador, and his mission is to serve as many way possible people that needs help. Over the year, he has created a written blog, a YouTube channel with educational videos, and his own podcast. So later, if you want, we can share his website where you can find all podcasts and videos. Dr. Harbisian has volunteered in multiple global clinics with one side and is on the board of a local organization called the Eyeglasses Project, which provides eye care to those in need. He is also a consultant and then a key opinion leader for multiple companies in the eye care industry. And in 2016, he was named Young Optometrist of the Year by the BC Doctor of Optometry. And he counted to use its passion to help as many people as he can. So now it's your turn to talk.
Okay, great. Now I talk. Okay, good. Thank you very much for the intro, Sylvia. I appreciate that. And thank you everybody who's joined in. Lots of people. Yeah, like you said, Sylvia, it's very cool to see lots of people joining in all over the world. And
that is duty.
want to say good morning and good afternoon and good evening, good late night, I think, for some of you who are joining in from Asia. And big thank you to Adaptica for reaching out and asking me to do this. Very happy to share my experiences. So as Sylvia mentioned, I had experienced these in a mobile vision clinic about a year or so ago. So we're going to talk about two particular devices, the Kaleidos and the Vision Fit. We're going to put more emphasis on the Vision Fit. But in general, we're talking about these advanced refractive technologies and how we can take our experience from a mobile vision clinic and hopefully apply it to our daily practice. So as Sylvia already mentioned in that very long intro, myself, okay, sorry guys, one second. Baby, you gotta go. Did you need? You have to go. Sorry, give me one sec.
Because I think that a lot of people don't know you so well.
So sorry, guys.
You have two kids.
I had that whole situation
so
in the wrap. I have two kids. I should have put that in the About Me section. Oh my goodness. You had time to read over my About Me there for a second. So we have two young kids, and it doesn't always go to plan when you have a toddler and an 8-month-old. So I apologize for that little disruption, guys. But back on track. Essentially, as Sylvia said, I have two optometry clinics, and outreach and education are two things I'm truly passionate about, and that goes with my. I started my own website and blog years ago, aboutmyeyes.com, and I have my own podcast, the 2020 podcast, which, aside from the super nerdy title, is my goal with that is I interview people from different industries to help share their stories and help us inspire people within my own industry with, optometrists, opticians, and other eye care professionals. And then, as Sylvia mentioned, I do some consulting and speaking, and that goes from, it's nice to do that for larger companies, but high school and elementary schools and things like that, really anything to share spread the message and share the importance of eye care. And then some NGO work, as you've kind of gathered already, With one site, I've done a couple of global clinics and one in North America as well. And I'm very proud to be on the board of a local organization called the Eyeglasses Project as a board member and clinical coordinator. And so I'm going to go into those things first here, the volunteer work, the NGO side of things, because that's where I think the initial sort of profound impact of these instruments, these devices was seen. And then we'll talk more about how they work and how we're going to implement them in our day-to-day. Before we do that, we do have a poll question I'd love for you guys to answer. So Sylvia, if you could put that up. The poll question is just below the slide there, or you'll see a green bar there that you can click. And just want to kind of get an idea. I've already seen a lot of people in the chat group, but I'd like to get a little bit of an idea of where everybody's from. So North America, South America, Asia, Europe, Africa, Middle East. All right. Good. Okay. Hey, Justin, good to see you on the call. All right. So I wanted to spend a little bit of time chatting about one site, because this is really where my experience with volunteering in these clinics began. And this is where, hello, Daniele, I'm going to talk about you in just a minute as well. And where my experience with Adaptica started as well. So just these photos just recap my three main experiences with one site. The first experience I had, that first picture with the young girl there, is I was actually in Chicago in 2011. So it was an inner city project where, anybody who's familiar, in the US with the way insurance works, there's a lot of families who don't have the coverage and don't have the access to the care. And that includes for their kids in some cases as well. And this was almost 10 years ago, so things may be a little different now. But we saw hundreds of children in this school, and we were, it was a really big impact on me. So from that point, I really wanted to get more involved in one site. So the second clinic, as you see in that second picture, was in South America, in Colombia. And we were in, you could see, a very open air place. It was actually a little soccer stadium. And we had some equipment like phoropters there to use. And then the third picture, now you don't see me in that picture, but what I wanted to show you was the setting. So we were in a little bit, one floor of a hospital building. And what you see is people lined up. And in the picture, you see dozens of people, but that went around the corner and there were dozens more, and it went out the building, and there were hundreds more in the lineup every day waiting to get their eyes examined. And what I wanted to really showcase here was the difference in the settings. Every one of these clinics is very different in its setting, different lighting, different size rooms, and in many cases with these global clinics, very remote locations. In Colombia, we flew into Medellin, then we took another flight for an hour or two, and then we took another bus ride for a couple of hours into this little town. And in Jordan, in that third picture, it was an hour and a half bus ride into a more remote area. So transporting equipment becomes a big mission. The logistics of this is a huge deal. How do you transport large pieces of equipment? How do you ship it, in freight and all that kind of thing? And then the amount of space that you have, as much as you try to scope out these clinics, sometimes you're stuck in a small room or the lighting's not very good. And then, of course, language barriers can be an issue as well. I wanted to touch briefly on this local project that I'm part of that I've mentioned already, the Eyeglasses Project. And essentially, the mission is similar to one site where we want to help people who have limited access or limited resources or can't afford the care. And we just do it on a much smaller scale. But again, in these pictures, what you see is in the first picture on the left, basically a small classroom type setting, and we have a little phoropter on a stand. In the second one, we had a much busier clinic. It was in a community center, but still a small, tight room, one room where we had to pack all the services in and bring in the auto refractor and things like that. In the top right corner, that was our biggest clinic in around Christmas time, if the hats didn't already give it away. And there, we had over 100 patients. We had a larger space, but now that we have to pack all the volunteers in, again, bring all the equipment in, And the lighting, it was a very bright setting actually. And anybody who's done refractions, you know, bright lights, actually bright settings can throw your refractions off a little bit sometimes. And then the bottom right picture was more for fun. I just thought, how many elves do you need to do an auto refraction? Santa's little helpers here. It was really cute to have them all part of the mission there. Sylvia, I think we have a poll question here where I'd like to get an idea, just in general, how many people in our audience have volunteered in these types of clinics. I think the North America one was, or the location one was still going there, but kind of a 50-50 split. That's really good to see. Good portion of people in the audience have participated in these types of clinics. Again, even with our local clinic, the challenges were one of the big challenges was the equipment. How do you bring this stuff in? Locally, I mean, you could throw it on the back of a truck or a big van and you can load it in and that's fine. But globally, obviously, it's a whole different conversation. So it looks like 60-40 split. That's really good. I'm really happy to see that there's so many people who have given back in that way. Great job, guys. So this is where we transfer the conversation into the new equipment, the new technology, the new options in refractive technology. And the two pieces of equipment we're going to talk about are the Kaleidos and the Vision Fit. So with, I don't want to oversimplify things here, but the Kaleidos essentially is a really nice advanced piece of auto-refractive technology. So this would replace the auto-refractor. And one of the things that we noticed on these global clinics was the auto-refractors were often inaccurate and unreliable. And the Kaleidos really helped their very reliable results. And one of the ways that it helps there is because it eliminates the factor of lighting. So if you happen to be in a very bright room, as I mentioned, it can throw off the numbers quite a lot. And here in the Kaleidos, as you can see in this really cute little picture, the picture with this cute little girl, when you look down the tube of the Kaleidos, it's just a black dark channel. So it kind of eliminates any additional extraneous light that will be coming in and affecting the results. And here you see a perfect example. This is Daniele, who's also in the audience there. Great man. He's one of the coordinators for some of these clinics, these global clinics. And you can see him. And Daniele, you can mention in the chat here, just to correct me if I'm wrong, but I believe this was on a boat on the Amazon River. So again, one of those very remote locations. And you can see this bright light shining in from one side. And that is something that could definitely throw off your results. And again, child looking through the Kaleidos. And, it's battery operated, doesn't require any electrical outlet. Again, that's going to be a challenge when you're in a remote location like this. And just easy to use, very intuitive in general for the user, and very easy for the patient. Literally, you just get them to look in like a pair of goggles, and the machine does the rest. Probably the most, significant, if not one of the top 2 or 3 most significant features of the Kaleidos is its portability and transportability. And you can see it literally packs into this briefcase and you can carry it. And when I was speaking to Daniele and he was expressing that was one of the most important features here is you literally can carry it on like luggage. Thank you, Daniele. Yeah, Amazon Clinic in Brazil, 2 boats navigating the Amazon River, emissaries to reach out isolated indigenous communities in the region. So that's pretty amazing work. Thank you for doing that. So you could basically carry this on like a suitcase, or you could check it in as luggage. You don't have to, figure out shipping and freight and the cost of all of that. So that's a massive benefit here. Before we move on, I think it's important to acknowledge some of the challenges that were faced, and more importantly, I want to acknowledge that Adaptica, we'll talk about this with the next piece of equipment as well, really was open to facing these challenges and head on and making the changes that they needed to make. So in these types of communities, when you're going into remote areas and somewhere like South America on the Amazon, people who haven't had an eye exam maybe ever in their entire lives, you expect to see certain types of conditions. Cataracts, pterygia are going to be extremely common. And that was the case when I was in Colombia as well. And as you know, from doing your standard eye exam, if you're trying to do an autorefractor on somebody with cataract, it makes it hard to find the results. So I know Adaptica has been making some changes in their equipment and technology to help overcome that. But in general, you know, dilated pupils help a lot. And that's something that we found in Colombia. We started dilating pupils and the results became a little more reliable and consistent. And although this is a very straightforward piece of technology for the user and the patient, there's a little bit of training involved. And I think that's something that whoever starts to use it will just kind of learn fairly quickly as you do the training with yourself or your staff. Again, it's fairly intuitive. So the next thing I want to talk about is the evolution of the refraction. So some of these pieces of equipment might look familiar to you if you're old enough. But, you know, we're going back decades, if not centuries here, to the loose lenses and the old trial frame sets and the Benjamin Franklin bifocals, to the early stages of what a phoropter used to be, to in 1965. I mean, I'm guessing most people in most people's offices, that's what a phoropter looks like. And it's crazy to think that's been around for over half a century, unchanged for decades. And then in the, you know, roughly in the 2000s, the digital phoropter came about, and I know some people use that. So the next poll question I'd like to ask you is, what type of refractive equipment do you use most often for most of your refractions? For any eye care providers out there, do you use trial lens sets? Do you use a phoropter, digital phoropter? What are you using in most cases? Again, fairly even split. All right, so fairly even split between, well, I guess now it looks like standard phoropters taking the lead, which is what I would have guessed. And, you know, like I said, this thing hasn't changed in so many years, unless, like, you know, one additional little knob to turn on a backlight or something like that. It's been basically the same. And this is where I wanted to put some music in there to really introduce the next generation of refractive technology, which is the Vision Fit. And this is the piece of equipment that I really got to use and love when I was in Jordan. So the Vision Fit is an innovative, electronic, tunable, mobile, and wearable system of lenses. Everything's about wearable tech these days, right, guys? It performs a subjective sight examination and effectively replaces both trial lenses and the manual or electronic phoropter functionality. So subjective refraction is what we're talking about now, compared to with the Kaleidos, you know, it was objective, like most autorefractors will be. So just want to show some images of what it kind of looks like. You know, it is very functional and has a lot of beneficial uses, but what I've found so far in practice is the wow factor for the patient is always helpful. So you got this piece of tech that clearly looks like it's advanced, it's futuristic, and that's not going to hurt when your patient's putting it on their head. They're going to know that they're doing something very different. But again, the portability factor you see in that third picture there packs up into a small briefcase, and that was very handy for us, obviously on the mobile clinic, not just to be able to carry it to the clinic, but even within the clinic, we had to kind of move it around from room to room, and to have it in a small case like that was very helpful. So how does this piece of technology work? How do you get a subjective refraction and change lenses in a headset that is wireless, that's not on a stand, that doesn't have little flips that we, you know, switch back and forth and ask 1 and 2? So this is really where the technology lies, is in these lenses and the kind of the little electronic motherboards that they're connected to. So there is, they call it membrane deformation. So there's 2 membrane surfaces, and there's a liquid between those surfaces, and little electronic pulses based on what we're choosing on our user interface, which is a tablet, will change the shape of the liquid within those membranes. And what you have for spherical is built into the device, built into the headset, is +10 to -10 diopters. And then there is a +10 or -10 loose lens that you can put on top. So it actually can go up to +20 or -20 on spherical. And then as far as the cylinder is concerned, there is a lens that will rotate and provide you continuous power around the clock in 1 degree increments, obviously more accurate than our standard 4-opter, maybe more accurate than we really need it to be. But I believe that goes up to 10 diopters as well on the sill. So very, very cool. And that's built, like I said, right into the goggles there. We don't have to, as a practitioner, we don't have to touch that at all. It's just built right in. So what are the advantages of this piece of equipment? I wanted to show you kind of what my initial experience was and what I found the benefits and the advantages were. And that's me there, as you can see, with a patient who's wearing the headset. And this room was actually fairly small. Definitely, you know, in an exam room, we kind of want that 10 feet, and then you got a mirror on the wall, let's say, and you can see the chart behind the patient. This room was not even close to 10 feet. So being able to account for that difference in the distance was one feature here the software allows you to do, which was really beneficial. But again, not needing the big stand with the 4-opter on it, and not having to go through the kind of that tedium of like switching lenses out in a trial frame was the kind of the initial immediate benefit. It's adjustable. It fits most heads, if not all heads, size heads. So that's adults and children. And of course, as you can see in the picture here, we had many females, many ladies with headdresses, and they were comfortable with putting this right over top. It worked well there. Before I move on to some of the more kind of the intricacies of the app and that type of thing, again, I want to just mention a couple of the challenges that we faced. And again, recognize Adaptica because they wanted me to mention these challenges. So the number one thing you can imagine as a challenge here, the device needs to connect to the tablet that you see I'm holding. And in the first generation of this device, what you see me using here, it connected with Wi-Fi. And if you have a Wi-Fi device, if you have any devices that connect via Wi-Fi, usually you know there has to be some network that they connect through. And that was the case with this device. And when you're in a remote location, especially if you're on the Amazon, like you saw in that picture with Daniele, but even here in the Middle East, finding a good solid Wi-Fi connection can be tough. And while one site did a very good job of bringing a lot of equipment in, I was in this room, I was probably, I don't know, 50 meters or more away from kind of what the hub was in the clinic. So Wi-Fi signal, especially through all these different walls and that distance, doesn't really travel well. We tried multiple hotspots and eventually we got a good signal, but that was one of the difficulties, getting the devices to pair, the tablet and the device to pair, because the signal wasn't the best. Now, what Adaptica has done is they've now started using Bluetooth to pair their devices. So you don't need that Wi-Fi connection to connect to. You just have the devices pair via Bluetooth. And as everybody, I'm sure, knows, very reliable and strong connection when you use Bluetooth. The other thing that's really not any fault of Adaptica, but there was definitely a pretty steep learning curve with this device in particular. I think some of the practitioners were a little discouraged in the early stages of using it, and that includes me, because you got to figure out the buttons, right? And sometimes you feel like, oh gosh, I'll just throw in some trial lenses, it'll just be faster. But after using it for 8 or 10 patients, you start to get a rhythm. And once you know, okay, you've got the patient's starting point already plugged in, you really only got to click a few buttons to get to the end point. And so having good training right off the bat is very valuable and very important here. But once you have that, it really is very efficient and a much smoother process than trying to do trial frame refractions. We were eventually, there was a handful of us kind of fighting over who's going to use the Vision Fit every morning. I often did not win, but at least I got a good amount of experience with it. So I wanted to show you what the user interface looks like for the practitioner. So you would have a tablet, and it's what you see on that picture of the tablet is what you actually will see as the user. It's very clean, straightforward user interface. This other picture on the right-hand side, it looks a lot more complicated because there's all these lines on it, but I just wanted to show you the different factors and the different numbers that we can adjust and how easy it is to adjust them. Literally, if I want to adjust this, the spherical value, I would touch that button. You can see it's actually highlighted in blue right now for the right eye. I would touch that button and I would either turn the knob around or I'd hit the plus or minus button and it would increase or decrease. It's very straightforward. for, I'm just going to see if I have it on the next slide. I think I do here. But, you know, you can fog one lens, you can change the cylinder, you can do all these things one lens at a time, or you can do it binocularly and make all those changes. So very straightforward once you get used to using it. So I want to go through a few of the features here. Some of you already might have wondered, I know I did when I started using it, was how do I do a cross cylinder, right? JCC. So normally when you have a phoropter in front of you, you just flip the lens in, and then you flip the lens back and forth, and you ask the patient which is better, one or two. And that's already built into the Vision Fit. So what you would do is you can see on that right picture, the value of negative 0.75 is already highlighted. So what you would do is patients got the headset on. You have a starting point for from their autorefractor. You want to do cylinder, so you just click on that value, and there's a button on the right. I'll go back and show you here. If you look on the right-hand side of this screen, you see bottom right, you'll see a little button that says JCC Auto. So you would just click that, and essentially it will take you through a very simple process of the simple, which is better, one or two. All you would do is hit one of those little arrows and ask which is better, one or two. And then when the patient says this one's better, you hit the little check mark. And then when you want to do the axis, you just press that value for the axis and you do the same thing. So it's a very, very simple, intuitive process for doing the cylinder. It also has a way for you to discover. So that was a refinement if you have a starting point, but actually has a way for you to discover it. So let's say you're starting with a blank slate and you don't know if the patient has astigmatism or not. It has a process for you to go through to discover the astigmatism as well. So that's very cool. On the left here, this was a feature that I really loved. And what you can do is you can have 4 prescriptions input into the software for the patient. And you can, with a touch of a button, you can go between all of those prescriptions. And that, if you haven't already thought of a way that that's valuable, we're going to touch on how that can be really helpful in a regular office setting. I don't want to overwhelm people with the amount of text on this slide, but again, there's a few additional features that are really nice. You can work with a spherical equivalent. The software will automatically just do a sum for the spherical equivalent. The resolution steps are very small, way smaller than what we need in standard practice, but 0.05 diopter steps for the sphere, and as little as 0.08 diopters for SIL. So extremely accurate. And I think we know that, right? When we get into this kind of digital tech, it's far more accurate than any of the analog stuff we generally use. There's a contact lens mode, which is very, very handy, can be very handy in daily practice. I'll talk a bit more about that. And correction at far point, so you can set what the focus, the distance target is through the software, so it accounts for that difference in the distance. So I imagine some people have some questions at this point. We're going to try and take questions at the end, and I think Sylvia might have already mentioned it. There's a question thing at the bottom, so if you have any questions, feel free to drop them in there, and I'll try to address them when we're all done. So how can we take this amazing technology and apply it in the office? And I think there's some obvious applications, one of them being in high density places, high density cities or areas where you have a very small office, retail spaces at a premium, and maybe you don't have you want to save the space that you might use for a phoropter and a stand and things like that, and just use a couple of pieces of refractive equipment that have a small footprint. The other setting, of course, is in rural places where maybe you don't have access to this equipment. But another setting or another type of patient where I was thinking that this could be really helpful is for wheelchair patients. And I'm sure we've all, any ECPs in the audience, we've all had the experience of having patients come in a wheelchair, and we want to provide the same level of service to this patient as we do to somebody who's walking in. And some patients can transfer out of the wheelchair and into the exam chair, and that's great. In some of our offices, we have the exam chair can move back, so the wheelchair can go into its place, but the phoropter sometimes doesn't quite come down to the right level. The patient has to reach, or the wheelchair is sitting in front of the exam chair, and then that distance is different, and we have to try to account for that. Now we can have the patient roll in the wheelchair and put this headset on, and the software will do the calculations for us on the distance, and the patient gets to sit in a comfortable posture like they would like to, and we can check their prescription. The device, as I've mentioned multiple times, is very portable. So if you happen to be an owner who is moving around, or if you happen to be somebody who's doing mobile vision clinics, or somebody who's traveling, I know there's, you know, I have some colleagues who do travel out to other communities, whether it's, you know, indigenous or other types of communities who have lack of resources or access. Again, it's very valuable there. But something that I thought was maybe kind of fun, you know, was as an associate, if you happen to be working as a locum and you're going from practice to practice, one of the things that I found working as a locum was every time I go into a new office, I have to kind of reorient myself. And while I might be really efficient as a practitioner, I'm always slow because you know, everything's at different distances for me. So if you have your own equipment, that would help you be a little more efficient. But a couple of the other features that we mentioned, the spherical equivalent, easy for you to say, feature can be helpful, especially the contact lens feature, where you can simulate what a zero vertex distance would be. Basically, essentially, the patient can see what it would be like to wear a spherical contact lens on their eye, even if they have a little bit of astigmatism. And that could help streamline that process of contact lens fits. The other thing I mentioned was the multiple prescriptions that could be built in, plugged into the software. So I love this one because I'm always doing trial frames for most of my patients anyway. And I'll say, okay, here's your distance prescription. Now hang on a second. Let me plug in your reading, and okay, go ahead and look at your phone. Okay, now hang on a second. Let me flip that around. Now look at the computer screen. That's what your computer prescription will be like. I'm spending a fair amount of time doing that. With the Vision Fit, you literally click a button and say, okay, hey, go look at your phone now. Click a button, look at my computer screen now, and so on. And so it streamlines that process, and it's up to 4 prescriptions that you can have built in. Kate says she would love that feature. I know. I got pretty geeky over that myself. And the last thing is, you know, with everything that's going on right now, you know, and the importance of physical distancing, it's valuable to have equipment that allows us to maintain a bit of a distance. And these, as you know, these are both controlled with a tablet and remotely, so the practitioner and the patient can keep a reasonable distance, and that can be very valuable moving forward because you know, we don't really have a clear outline of how long we're going to have to maintain these physical distance protocols. So that can be quite helpful in the near future and in the long term as well. So that's all the information I have. I hope everybody found that interesting and got some useful insights. Thank you very much for joining. And my email address is there. Feel free to shoot me an email anytime. You can also find me on social media. As many of you probably already know, I'm all over social media. I'm happy to answer any questions that you have.
Yeah, thank you, Doctor, for this, for sharing your experience on mobile clinics with OneSight, but also what you think could be the right usage of our equipment in clinics. So as the doctor said, we have the box question where you can put all the questions you want. Meanwhile, I just want to remember that we have an ongoing spring promotion on our devices, so you can see an orange bar up here if you want to check our website. On the live chat, I will share your blog, so about my eyes, so everyone can check your blog too. See that you already have 2 questions. Okay.
Yeah, I see that. Yeah, thank you guys for asking the questions. So Justin, I'm going to ask you if you don't mind clarifying the NMWRS system remotely, just so I'm on the right track here to answer your question. And that might be one for Sylvia more than for me, actually. The patient is working with a tech in one location, but the doctor in another location. If you are able to just drop that in the chat or the questions again.
We have.
Okay. Oh, wireless refraction system. Okay, thank you for clarifying. I'm clearly Justin's ahead of the curve on this one.
Do you want me to answer?
So yeah, Sylvia, do you mind? I think that's maybe a bit more in your...
All our devices, so Kaleidos and Vision Fit, are remotely controlled by a tablet. So yes, you can basically work on another room, but depends, of course, from the tablet, how strong is the connection, because it's through Bluetooth. So I can tell you exactly at which meter distance you can still run the measurement, but oh, in another country. Okay, well, no, right
Okay.
now for Kaleidos, no, but with Kaleidos Plus, we have the EMR connection and the cloud storage. So basically, yes, you can do the measurement and a doctor in another country can see the results. So I think I answered to your
Yeah.
question.
Yeah, I think Justin might be considering, these sort of remote refractions that are potentially going to happen, where people are sort of outsourcing a refraction to other countries. So another question on the Kaleidos. There's a lot of talk these days related to contamination from the eyes. Do you find this is disadvantage for this device? Yeah, so there's definitely been some reports of COVID being transmitted through the eye. Luckily, I don't think there's been too many cases, but of course, anytime you're touching a surface, that's something that will be important to consider. I think as long as, just like any other equipment in the office, as long as we are sanitizing appropriately,
Yeah,
the risk should be
Kaleidos can
fairly
be
low
clean,
on that.
but also it comes with the plaster masks, so you can use with a patient and then use a new one with another patient. So you don't touch the instrument and you
Oh,
don't have
perfect.
contact with the previous patient. And also you can sanitize the plastic.
That's perfect. Got it. Can you share some videos of the actual process? Is there somewhere people can go for that?
Sorry, I was just reading the
Sylvia, is there
answer
somewhere?
of actual process. Yes,
Oh,
you can write us an email at webinar@adaptica.com, so we can share everything you need.
yeah. And Todd Wiley has a question about prisms. And I do know that there is some prism ability and there's some prism features available. I can't speak to that through my personal experience. Sylvia, could you share something on prism?
Yes, of course. Not me, because I'm not the product specialist, but same as for you, if you write us an email at webinar@adaptica.com, our product specialist can give you all the correct information, because maybe I can say something that is not correct. So I prefer not to answer, but of
Yeah.
course our product specialist will do that.
Okay. Okay. Sorry, I couldn't answer that directly, Todd, but there definitely is some. I do know that there's some prism features that can be used. I just can't remember the exact extent, so I also don't want to say too much. How does the app work in terms of patient records? So if in a day I see 30 patients, at the end of the day, can I see a summary of all their diagnosis in the app? I believe there's a way to print. I'm going to keep pushing all the questions to you, Sylvia, but you could print out all the reports in case you wanted that. But Sylvia, is there a way that
all the
we can go
exam,
back and
and
see them
then
again?
on the main page you can check all the reports or the examination that you have done during the day, but also during the month, the year. So yeah, maybe they're going to technical question, because you use in outreach projects. So yes, your focus was to serve as more people as possible. So you were just prescription visit. So you are not,
Yeah, exactly.
you didn't have the chance to go so deeply into technical
Yeah,
information.
yeah. I apologize, guys. As Sylvia said, our mandate was we were seeing like literally somewhere near 500 patients in a day, not individually, but as a team. And so we were trying to get the best refraction we could, and then anything beyond that, we were kind of triaging. And so when it came to some of these more complicated cases, we weren't actually dealing with it right there on site, and we weren't, and we were keeping paper record and other charts, not
But
through
through the
this form that
application you
the
can
question was
save,
asked.
you can send, you can print, and also you can customize. So you can do almost everything.
Yeah, can you, another question here. Can you just depend on the Kaleidos and Vision Fit to prescribe glasses to your patient without the use of on autorefractor? Yes, short answer. We were using the Vision Fit to give prescriptions, and eventually glasses were made. We were using the Kaleidos as an autorefractor to then use that, input that into the Vision Fit as our starting point. I don't know if that answers the question directly. So great. So it looks like Leandro is going in and answering some of these as well. Will Bluetooth connectivity enable two Vision Fits to be used in close proximity without interfering with each other? Sylvia, that's on you, because we only had one in the room
more
at the
than
time.
one at the same time. Also with Kaleidos, I think that probably in the vision clinic you had on the Amazon River, you had several Kaleidos working together at the same time. But well, you had the Wi-Fi version. Now it's Bluetooth, but no, every Kaleidos is paired to its own tablet, so you don't have interferences between two devices working together in the same room.
Yeah, perfect. Thank you for the question, Jamie. Oh yeah, so Jamie, I think the question went away there, but Jamie was, because Jamie was on the clinic in Jordan as well, and so she's an optometrist as well and was using these. And she was saying that the tablets would switch controls between the two devices intermittently. That was part of the connective connection issue that we had. But I think with Bluetooth, it's going to be a little more reliable and distinct. Whereas the Wi-Fi, sometimes a signal was kind of crossing over, it seemed like. That's like having two sets of headphones on Bluetooth in the same room, as long as they're connected to their appropriate devices. They don't usually cross over, right?
So it didn't have problems. Also, yes, Daniela is confirming that we're using different Kaleidos working simultaneously in the same room. So first I want to share, sorry, your blog on the chat, so everyone can,
Oh, okay.
Okay. Aboutmyeyes.com.
Thank you. Aboutmyeyes.com. Yeah. So you'll probably laugh when you get to the homepage.
Well, seeing your video
it's a
are really
picture,
funny, but also really interesting.
Thank you.
I don't know if
thanks for sharing that.
You have other questions to ask.
Can the device be used after cycloplegia? Would it be accurate? I believe so. We in the office, we use an autorefractor after cycloplegia, and that generally is fairly accurate. Then I'll do my retinoscopy and my refraction over top, and those numbers are usually pretty accurate. And the Kaleidos is, I would say, more accurate than your standard autorefractor, and the Vision Fit would also be, as you saw with the level of detail that you can go into, the smallest diopter steps that you can go into, it's a very accurate instrument. Definitely no less than your standard 4-opter would be.
Okay, I think that if you don't have any more questions.
Nope, good. And yeah, I'm good. I don't have anything personally to add. So I want to say thank you again to everybody who joined in, and thank you to Adaptica.
Well, thanks to you, and hopefully we will see in person. I don't know when, next year?
Yeah. Next year, maybe. Yeah. And hopefully I can see people in the audience. Maybe we can let's all make a plan to meet at an event next year.
The recording will be available later. Yes, you will receive a link with the replay 2 hours after the end of the webinar. But also we will share in the next weeks all the replays of all the webinars we had in the past month. So okay. Okay, so no more question. Okay, thank you, Daniele. And yeah, hope everyone is safe.
Thank you, everybody.
And hope to see you really soon. And
Oh yeah, sorry about
Don't
the little
worry.
interruption in the beginning. I really wanted to just
You
bring her
could
in and
have.
show everybody. But she got a little upset.
I saw
So
pictures. She's
I
so
know I
cute.
should have. I probably should have.
Okay, thanks again for
Thanks.
joining us and for
Thanks,
sharing
guys.
your experience with us. I wish you a great day since it's 10. Okay.
Yep, 10 a.m.
And
Just to start.
see you soon. Thank you again.
Thanks.
Hello, everyone. Bye.
Thanks, guys. Bye.